Welcome back to this next video in which we are studying headaches. Okay, so we've just been discussing the innervation of the meninges, and what I now want to move on to is discussing the arteries that are in the meningeal layers, and we can split the arteries that are in the meningeal layers into two categories: the meningeal arteries that actually run in the external meningeal layers, by which I mean the dura mater and the arachnoid mater. And those meningeal arteries run in those layers and they supply those outer meningeal layers with blood. The other category of arteries that are in the meningeal layers are going to be in the subarachnoid space in between the pia mater and the arachnoid mater. And these arteries are going to be extraaxial cerebral arteries. They're going to be arteries that are going to supply the brain parenchyma, but which are at the moment outside of the brain parenchyma, hence why they're called extraaxial cerebral arteries. So when you see a specimen of the brain and you see it covered with arteries on the surface, that is the arteries that would be in the subarachnoid space. And which are over the pia mater, and those are the other arteries that I want to discuss the major examples of. And the reason, remember, that we want to study this anatomy for understanding the pathophysiology of migraine headaches is because a lot of the meningeal nociceptors that we're very, very interested in, because they're the ones that are going to be activated to give rise to the migraine headache, a lot of those meningeal nociceptors innervate the walls of arteries that are in the meningeal layers, both the meningeal arteries and also the extraaxial cerebral arteries. So that is why I want to discuss the anatomy of them. Firstly, the meningeal arteries, and then secondly, the extraaxial cerebral arteries. In addition, this discussion will come in useful later on for other types of headache that we want to discuss, so this anatomy is going to be useful. Alright, so we will begin then with the meningeal arteries, the ones which run in the outer meningeal layers and which are going to supply the outer meningeal layers with blood. So there are 6 of these which come in 3 pairs. There are 2 anterior meningeal arteries, 2 middle meningeal arteries, and 2 posterior meningeal arteries. And I bet you can guess where roughly they are going to be and which regions of the outer meningeal layers they're going to actually supply. So let's now go over the anatomy of these 3 pairs of meningeal arteries. So we will begin with the middle meningeal arteries, and the reason we'll begin with those ones is because they're by far the biggest ones. They're going to supply really most of the outer layer of the meninges with blood. And if you're just going to remember one example of a meningeal artery, it should be the middle meningeal arteries rather than the anterior or the posterior ones. So let's begin with the middle meningeal arteries. So the middle meningeal arteries are branches of the maxillary arteries, which are themselves branches of the external carotid arteries. So let me firstly show you the external carotid arteries. So we'll go back to this picture here where we are seeing the skull from the left side, and I will draw the left external carotid artery coming off the left common carotid artery. So let's start by putting the common carotid artery on here. Now, I'm not going to use red because we've already used red a lot, and I don't think it will show up particularly well if I use red. For instance, the red of the masseter muscle isn't really showing up particularly well here. So I'm going to go for some completely different colour that I think will show up well, and I'm going to go for green. I know that's not a particularly typical colour to draw arteries in, but so that it shows up, I'm going to do it in this colour anyway. So I'm going to start by putting the left common carotid artery on, and of course this is in the neck. So on both sides in the neck you have the 2 common carotid arteries ascending up the neck, and these supply the major component of the blood that is coming up to the head and neck region. Okay, and these are freshly off massive blood vessels. The left common carotid artery comes off directly the aortic arch. The right common carotid artery, that nearly comes off directly off the aortic arch. But remember, firstly, there's that brachiocephalic trunk, which splits into the right common carotid artery and the right subclavian artery. But they come off massive blood vessels that are freshly, that are carrying fresh blood out of the heart. Okay, so this artery in the beautiful green colour here, this is the common carotid artery. Now, the reason it's called the common carotid artery is that it is the artery before it splits into the external carotid artery and the internal carotid artery. So it's the combination of the two, if you like. At the level of the superior border of the thyroid cartilage, which is a component of the larynx, that is the level where the common carotid artery bifurcates, and that's quite high up. So the thyroid cartilage anteriorly, that creates the Adam's apple. So if you feel your Adam's apple, that bit of cartilage that goes back from the Adam's apple, that is the thyroid cartilage, and the superior border of that, try and feel it on yourself, that is where your common carotid arteries on either side are going to bifurcate into external carotid arteries and internal carotid arteries. So let's now draw this here. So here, this one can be the external carotid artery, and then this one is the internal carotid artery. So for short, the internal carotid artery, which is the one at the back, that's called the ICA, and the external carotid artery, which is the one that's going more forwards, that's called the ECA, external carotid artery. So I'll use these abbreviations rather than writing their full names out. Okay, so we're not interested in the internal carotid artery at the moment. We will be interested in the internal carotid artery later on when we want to discuss the anterior meningeal arteries, but for now, we're interested in the external carotid arteries. So I'm not going to show you all the branches of the external carotid artery at the moment, because there are absolutely loads of branches that come off the external carotid artery. We don't need to know all the branches of the external carotid artery. I just want you to know some of the absolute basic ones. So the external carotid artery is going to continue upwards towards the bottom of the mandible, and then when it gets to the bottom of the mandible, it's going to go behind the ramus of the mandible, so medial to the ramus of the mandible, so you wouldn't actually be able to see it. It would be behind the ramus of the mandible here, and then it will ascend up behind the ramus of the mandible into the infratemporal fossa here, and then it's going to give off two major branches, the maxillary artery and the superficial temporal artery, and of course it's the maxillary one that we're interested in. However, the first major branch that I don't think I can neglect is the fact that it gives off the facial artery. So I'm going to tell you three branches of the external carotid artery at this point. So it's coming up, it's going behind the ramus of the mandible. I'm going to draw it on even though you wouldn't actually be able to see it. And the first branch it gives off is going to be this facial artery here. And then the rest of the thing is going to continue on upwards like that. Okay, so this first branch coming off the external carotid artery, or the first major branch coming off the external carotid artery, it's not actually the first branch, there are others, but this is the first major branch that I think is significant enough for me to have to put it on the picture, that's coming off the external carotid artery here. It's behind the ramus of the mandible in our picture, or the body of the mandible rather. It will be running medial to the body of the mandible, and then it's going to come down here and loop laterally over the side of the body of the mandible, and then it's going to ascend up and supply the face. So let me draw this on. So here it comes, it will loop over here, and then it will ascend up like this. Okay, and I'll try and complete it up here in green. So I hope you understand what's happened. Initially, it was medial to the body of the mandible, so we wouldn't have been able to see it. Like the external carotid artery was medial to the ramus of the mandible, the facial artery originally was medial to the body of the mandible. Then it's looped laterally over it, so it's now visible. It's on the surface, the lateral surface of the body of the mandible, and it's ascending up here. The lips will be here, and it supplies the facial tissue here with blood. And you can just about feel the pulse of this one. If you feel along the bottom of your mandible, and you do it very, very gently, you might, if you get it in the right space, actually be able to feel the pulse of your facial artery as it crosses the mandible, as it moves laterally over the body of the mandible at the bottom there. Okay, we don't need to know about the facial artery, it's just a major branch that I thought it was necessary to tell you about. So then what's going to happen is it's going to continue on upwards behind the ramus of the mandible here, and now it's going to split into its two major divisions here, like so. So one of them is going to go onwards in the infratemporal fossa. This one here is going to go onwards in the infratemporal fossa, and that branch is called the maxillary artery. And that's the one that's very, very important for us, because that's going to give off the middle meningeal artery. So that is the maxillary artery, the one going into the infratemporal fossa. This one is going to loop over the temporomandibular joint. It's going to come lateral to the temporomandibular joint here between the condyloid process of the mandible and the surface for the temporomandibular joint on the temporal bone, and then it's going to come over this, over the zygomatic arch here, and then go up and supply the temporal region, and that's the superficial temporal artery. So it's now visible here over the top in green there. So again, I'll explain that just so that you're absolutely clear on where its position is. Here, it is behind the ramus of the mandible. It is then looping laterally over the temporomandibular joint here, and it will be lateral to the temporomandibular joint. It runs lateral to the zygomatic arch, so it will be visible, and then it's going to go into the temporal region. And that artery is called the superficial temporal artery. So I'll put its name over here. So superficial because it's superficial, it's near the surface, and then it's in the temporal region, so hence why it's called the superficial temporal artery. Okay, and this will become important actually later on. This is a classic site, the superficial temporal artery, for giant cell arteritis to occur. Indeed, giant cell arteritis is also sometimes called temporal arteritis because this is the most common artery, or the classic archetypal artery to be affected. So all of this anatomy will help us more down the road. We will use it again, so it is important. So, external carotid artery, it's the one that moves forward. The internal carotid artery goes backwards and is going to go intracranially, whereas the external carotid artery remains extracranially for the most part. It runs behind the ramus of the mandible here, and then the first major branch it gives off is the facial artery, or the first branch that I considered major enough to tell you about that it gives off is the facial artery. This runs forward medial to the body of the mandible and then loops laterally over and supplies the facial tissue. The external carotid artery continues on behind or medial to the ramus of the mandible, and then the two major branches that it turns into, that it splits into itself, is the maxillary artery, which stays in the infratemporal fossa, and then the superficial temporal artery that loops laterally over the temporomandibular joint, goes laterally over the zygomatic arch, and then goes into the temporal region. Now, the maxillary artery is the one that we're really interested in because one of the branches that comes off the axillary artery is going to be the middle meningeal artery. So let me write this down, and in fact I might get a thick pen to try and put on the middle meningeal artery. So one of the branches coming off of my maxillary artery here, this little line that I've drawn there, that's going to represent the middle meningeal artery, and that's now going to go into the middle cranial fossa. How's it going to get into the middle cranial fossa? It's going to go through the foramen spinosum, which we have met before. That is the hole that the nervus spinosus went through. So this is the middle meningeal artery. So again, I'll remind you that foramen spinosum, that was lateral and behind, so posterior to the foramen ovale. So have we got, yes, we have. So this hole here, the foramen spinosum, which empties out into the infratemporal fossa. The two sides are the middle cranial fossa and the infratemporal fossa. Here is the middle meningeal artery coming off the maxillary artery that's in the infratemporal fossa. It's now going to go through that hole on the left-hand side, because we're talking about the left-hand side here, and it will arrive in the middle cranial fossa. And of course, where's it going to arrive first? It's going to go through the bony hole, and then what's it going to be greeted with? It's going to be greeted with the periosteal dura mater, the meningeal dura mater, and the arachnoid mater, the outer meningeal layers, and it will then just stay in those. It won't penetrate through to get into the subarachnoid space. It's just going to go into those layers, and it's going to run in those layers. Now, where does this artery go? So this is where I'm going to have to change colours, because I want to now go to this picture, of course, and I can't keep colouring them in green because I used green for my innervation of the meninges. So now I'm going to go back to the more typical colour to show arteries in, which is red. So here come the middle meningeal arteries through the foramen spinosum, like so, and they're going to go laterally. They're going to go onto the lateral wall of the middle cranial fossa, and what they do very quickly is they split into two branches. They split into two major branches, an anterior branch of the middle meningeal artery and a posterior branch. And I know I'm showing it as though they're leaving the cranial cavity here. I think that they're not, of course, leaving the cranial cavity. They're not going to go through the bone. This is just trying to get across the fact that these are above this, so they've gone upwards and they're still on the internal wall of the cranial cavity within those outer meningeal layers. So they're ascending up on the lateral walls, and then they're going to very quickly split into an anterior branch of the middle meningeal artery and a posterior branch of the middle meningeal artery. And although these look small on my picture, these are the biggest of the meningeal arteries, and this is going to cover a huge amount of territory of the outer layers of the meninges. A huge amount of the outer layers of the meninges are going to be supplied with blood by these branches of the middle meningeal arteries. So really, on this picture of the skull from the side here, it's going to be, a huge amount of the meninges in this region that will be supplied by the anterior branch of the left middle meningeal artery, and a huge amount of meninges in this region will be supplied by the posterior branch of the middle meningeal artery. So I'll stress this again, these are the most important meningeal arteries. If you're just going to remember one meningeal artery, you must remember the middle meningeal artery. Very, very important. Okay, right. Next, let's go on to the anterior meningeal arteries, and then we'll go on to, finally, the posterior meningeal arteries. So the anterior meningeal arteries, I'm afraid, requires us to discuss more complicated anatomy. We need to discuss the internal carotid artery, which I'm afraid is slightly more complicated than the external carotid artery. So, drawing this on this picture again, so the internal carotid artery is going to ascend upwards as well and go into the infratemporal fossa as well. Okay, so it's going to go up there as well, but it's going to be more medially and behind the external carotid artery. The external carotid artery, it's just underneath the ramus of the mandible, whereas the internal carotid artery, that's much further inwards. It's much more medially, and it's also posterior, but it will end up in the infratemporal fossa as well. Now, which hole is it going to use to get into the cranial cavity? It uses one that I think I probably put on long ago onto this picture, but which hasn't copied across, which is the carotid canal. So, let me mark on some more foramina onto this picture. So remember there was the foramen lacerum that was in this position, just underneath where the trigeminal ganglion is. That's a massive great hole in the base of the skull. But also, behind and lateral to the foramen lacerum is the carotid canal. So this hole here is the one that's very important for us now. This is the carotid canal. And this isn't a simple hole because it's more of a tunnel. You might think that if we wanted to make a hole for the internal carotid artery to come up into the middle cranial fossa, that we just drill directly down. But to make the carotid canal, what you do is you sort of drill a little bit in, and then you go sideways, you turn your drill around, and you sort of chisel through the bone a little bit, and then you decide to go back down again, so that you end up with a sort of strange hole. If you look into the carotid canal, you cannot see the infratemporal fossa because of the fact that it doesn't go directly down through the bone. It sort of goes in a strange shape, a sort of S shape or a sigmoid shape again. It for a while tunnels laterally through the bone, and then it tunnels down again to end up in the infratemporal fossa. So it's a strange one, the carotid canal. But that's the way that the internal carotid artery is going to get up into the middle cranial fossa. So it comes up, enters the infratemporal fossa, enters the opening into the carotid canal that is in the infratemporal fossa, back here in the infratemporal fossa, and then it will run through the carotid canal and it will emerge out of this side in the middle cranial fossa now. Okay, so we're going to have our two internal carotid arteries arriving on either side in the middle cranial fossa. Now I will just draw them in here. So here they go. Now, there's going to be a little bit of complicated anatomy here, and this is going to test how well you truly understand the meninges. So again, when it arrives up into the middle cranial fossa, the first thing it's going to be greeted with is the periosteal dura mater, and then the meningeal dura mater. And what it's going to do is it's going to gradually make its way sideways in those outer layers of dura mater, so the periosteal dura mater and the meningeal dura mater. It's going to stay in that layer, and it moves forward over to where the foramen nasserum is, in those outer meningeal layers, okay? So it hasn't penetrated through the dura mater, it's running in the dura mater initially. Now, of course, in this position, not shown on this picture, but in this position, what is there? There is the cavernous sinuses. And remember, the cavernous sinuses are where the meningeal dura mater and the periosteal dura mater have split apart, and there is a great big venous sinus in between them. Now, our internal carotid artery that was coming forward here, it was sort of running in the periosteal dura mater and the meningeal dura mater. It was sort of running in those layers, and now they've split apart, and it actually ends up going into that cavernous sinus, that venous sinus, in the gap between the periosteal dura mater. And remember, the periosteal dura mater will be lining the bone, and then you'll have loads of blood, and then the meningeal dura mater will be forming the roof of the cavernous sinus. So it's actually going to end up going into that cavernous sinus, and I hope you can understand sort of how that can actually work. So, I might even try and draw you a few pictures to convince you how that could work. So, let's draw a picture of the cavernous sinus viewed as though we've taken a cross-section, a coronal cross-section through it. So I'm going to imagine we cut through in a coronal section along this sort of line, and I'm just going to draw you the little cavernous sinus. Let's do it on the right-hand side here. So, where shall I put this picture? There's not that much room. We'll go up here. Excellent, some space here. So, starting with the blood, here is the venous sinus, the actual place where the blood is here. So, here we go. So, just to orient you, this is medial, this is lateral. We're talking about the right-hand side one. We're imagining we're viewing from behind rather than from the front. So, this is the top and this is the bottom. Now, the floor of the cavernous sinus, that's going to be made out of periosteal dura mater. So let me put this in here. So periosteal dura mater is here in purple. So all of this is, and I'll completely make the lining up here, this is all periosteal dura mater, coloured in pink here. Okay, let's now do the meningeal dura mater in yellow here. Now, initially, the meningeal dura mater will be adhered nicely up against the periosteal dura mater. So down here, they're nicely adhered to one another, but then they have split apart here to open up that gap that is the cavernous sinus. So there we go. There is the meningeal dura mater in yellow there. And then finally, on top of the meningeal dura mater, you then of course have the arachnoid mater here in green, and then if you went outside of the arachnoid mater, you'd then of course be in the subarachnoid space, and then there would be brain here surrounded by pia mater. Okay, so really the internal carotid artery runs in these layers here, and you can imagine that it might be right in the middle between the periosteal dura mater and the meningeal dura mater, and then when they split apart, it's going to then end up in the cavernous sinus. So, drawing this on here now in red, and I'll get a thicker pen for it. Here comes our internal carotid artery, and then it ends up in the cavernous sinus. Now, it then goes into a very weird shape inside the cavernous sinus. It doesn't just simply go up through the cavernous sinus, it goes in a strange shape. So I now need to draw another picture of the cavernous sinus, where we are imagining that we are standing in this sort of position here, and looking at the cavernous sinus from the side. So I remind you, this is the right cavernous sinus. The sella turcica would be here, the bone is here, this is the bottom of the middle cranial fossa, the sella turcica would be here, and this is where the brain would be, the temporal lobe, the right temporal lobe would be. So we're now going to stand where the right temporal lobe would be and look at the cavernous sinus from that right-hand side. So let me get my blue pen back. So here is the cavernous sinus now viewed from the right-hand side, and I need to go back to the thinner pen. So here is the actual blood. I won't put the meningeal coverings on yet, because I hope you understand that if we were looking from the right-hand side, we'd be seeing the arachnoid mater first, underneath that would be then the meningeal dura mater, and then we'd be into the blood. What I want to show on this picture is the shape that the internal carotid artery is going to go in. So of course it's going to arrive in down here, because it's come in from the back. It came in from this place, so the back of the cavernous sinus, and this is representing the back, this is the front, this is the top, this is the bottom. We are looking from the lateral side. And then it goes in this sort of shape, like so. It goes forward a bit, then goes up, and then it's going to leave the cavernous sinus. And how is it going to leave the cavernous sinus? To leave the cavernous sinus, it has to get through the roof of the cavernous sinus. The roof of the cavernous sinus is meningeal dura mater and arachnoid mater. So it's going to penetrate through the meningeal dura mater, it's going to penetrate through the arachnoid mater. Where will it then be? It will be in the subarachnoid space. So it penetrates into the subarachnoid space, and then it coils back on itself like this in the subarachnoid space. So it goes over the cavernous sinus now in the subarachnoid space below brain, that will then be above it here, surrounded by pia mater. So it's running here in the subarachnoid space. So that's the internal carotid artery. So that's the way that it maneuvers itself through the cavernous sinus. Now, why are we discussing this? We are discussing this because we want to discuss the anterior meningeal artery. Now, the anterior meningeal artery is itself a branch of the anterior ethmoidal artery, and you should recognize that. That's similar to anterior ethmoidal nerve, isn't it? And indeed, this artery goes through the anterior ethmoidal foramen, just like the anterior ethmoidal nerve. So we'll use some of the anatomy that we've previously seen. And the anterior ethmoidal artery itself comes off the ophthalmic artery, and the ophthalmic artery comes off the internal carotid artery, which is why I have just been showing you the anatomy of the internal carotid artery. So, we've done the internal carotid artery's journey through the cavernous sinus. Now, once it emerges from the cavernous sinus and it's now in the subarachnoid space above the cavernous sinus, one of the first branches it gives off is the ophthalmic artery. So this artery here is the ophthalmic artery, and we have not discussed this previously. Remember, we have discussed the ophthalmic nerve previously. We're now discussing the arterial supply to the eye, which is the ophthalmic artery. Okay, so this is currently, remember, in the subarachnoid space, and on this picture, I won't try and put it in on this picture, it will be going forward in this position. The internal carotid artery will be looping back over the cavernous sinus, and right at the front it's giving off the ophthalmic artery. Just to put something in on this picture, here's where the internal carotid artery would be when it's looping back over. If we took the right cross-section, we're imagining we had a cross-section at this sort of position, we would see the internal carotid artery here as it's going through the cavernous sinus, and then we'd see it again up here as it's now above the cavernous sinus and looping back over on the cavernous sinus. So right at the front, here, it gives off the ophthalmic arteries, and of course this will be happening on both sides, so you'll get the left ophthalmic artery and the right ophthalmic artery. Now, a classic mistake is to then say, aha, it will go through the superior orbital fissure and then it will be in the orbital cavity. It doesn't actually go through the superior orbital fissure to get into the orbital cavity. It actually goes through a very, very elitist little hole that not many structures that are going into the eye get to go through. It goes through the optic canal with cranial nerve number 2 itself. So it's actually going to go through these blue holes that somehow have actually managed to copy across. So those are the carotid canals there, and those will be where the optic nerves are going through into the orbital cavities. Now, as it moves forward, as it moves towards the optic canal, it will then of course have to break through the meninges, the outer meninges. At the moment it's in the subarachnoid space. To go into the orbital cavity, it's going to have to get out of the subarachnoid space, so it will have to penetrate through the arachnoid mater again, it will have to penetrate through the meningeal dura mater, and it will have to penetrate through the periosteal dura mater, and then it can go through that canal into the orbital cavity. Now, a point that you might have got confused about if you know some more advanced anatomy is you might think that maybe it would stay in the subarachnoid space. Now, why might you think it would stay in the subarachnoid space? Well, if you know something about the anatomy of cranial nerve number 2 that goes through the optic canal to the eye to take sensory information from the eye about vision, you will know that cranial nerve number 2 is actually covered by meninges. So we don't think of cranial nerve number 2, the optic nerves, as actually being peripheral nerves. We think of them as being part of the central nervous system because they're still covered by meninges. And indeed, the cells that myelinate, the neurons inside the optic nerve, are oligodendrocytes rather than Schwann cells, and oligodendrocytes are the cells that myelinate neurons in the central nervous system. Schwann cells are the cells that myelinate neurons in the peripheral nervous system. So it is with good reason that we think of the optic nerve as a part of the central nervous system rather than as a peripheral nerve. So, the ophthalmic nerve, however, does not the ophthalmic artery does not, however, remain inside the subarachnoid space that surrounds cranial nerve number 2. So let me just make this absolutely clear by drawing you a little picture. So if we have cranial nerve number 2 on the right-hand side here, so we're imagining this is the optic canal here. Cranial nerve number 2 has come forward. It will go to the eye, which we're imagining is going to be here. So this is cranial nerve number 2, the optic nerve on the right-hand side. What I'm saying is that this is still covered by meninges, so it will be lined by pia mater. It will then have the outer meninges as well, so it will have the dura mater and the arachnoid mater, and in between the arachnoid mater and the pia mater you'll have some subarachnoid space. So cranial nerve number 2 still has the meningeal covering. The meningeal covering goes through the optic canal. Imagine laying down dura mater and arachnoid mater over the entrance for the optic canal and then taking your finger and pushing them through the optic canal so that they can continue to cover the optic nerve, and that's how it actually works, and that's why we think of cranial nerve number 2 as being an extension of the central nervous system, or at least one of the reasons we think of cranial nerve number 2 as being an extension of the central nervous system. So just completing up this picture, if that's the actual nerve, let's let in green here that be the pia mater. Then around that you'll then have the subarachnoid space, and then in purple that's representing the arachnoid mater, and then in red that represents the dura mater, and both layers can be represented by that red line there. So cranial nerve number 2 is covered by the meninges, which form a finger-like projection going into the orbital cavity through the optic canal. So you might be tempted, what I was suggesting you might be tempted to think is, look, the ophthalmic artery was already in the subarachnoid space. What if it goes in through this sheath of meninges that covers cranial nerve number 2 and remains in the subarachnoid space? That would be kind of groovy, wouldn't it, if it did that? The answer is it doesn't. It doesn't do that. It's simpler than that. It penetrates out of them before it then goes through the optic canal. So it goes through the optic canal separate to the optic nerve covered by its meningeal sheath. So the ophthalmic artery, just to make this absolutely plain, it can lie next to this. So here it is. That's the ophthalmic artery. So it is outside of the meningeal sheath that covers cranial nerve number 2. Okay, so the ophthalmic arteries on both sides, they come off the internal carotid arteries. They're the first major branch to come off the internal carotid arteries once they're actually in the middle cranial fossa, and they're going to penetrate out of the subarachnoid space. So they will penetrate through the arachnoid mater, penetrate through the meningeal dura mater, penetrate through the periosteal dura mater, and then they will go through the optic canal, but outside of the meningeal sheath that covers cranial nerve number 2, and they will then end up in the orbital cavity. And I now want to show you the anatomy of the branches of the ophthalmic arch. The anatomy of the branches of the ophthalmic artery in the orbital cavity. So here it comes. We'll draw it in red and we'll put it on this same picture here. It might make things a little bit confusing, but we'll hopefully be okay. So here's the ophthalmic artery. Now let's talk about some of the major branches. One of the branches is a lacrimal branch. So here comes the lacrimal branch that's going over to the lacrimal nerve. I've actually missed off the first branch that comes off the ophthalmic artery, which is the central retinal artery. And it would probably be better for me to show this on this picture here. So one of the first branches the ophthalmic artery gives off as it's running next to the optic nerve, cranial nerve number 2, coming into the orbital cavity, it's going to give off a central retinal artery that penetrates through the meningeal layers that cover the optic nerve and then actually goes into the center of the optic nerve and runs in the center of the optic nerve. And then when the optic nerve enters the back of the eyeball, it will be delivered onto the surface of the retina and it's going to supply the cells on the surface of the retina. So this artery here, the first branch of the ophthalmic artery, that is the central retinal artery. And again, we'll have use for this piece of anatomy later on when we talk about giant cell arteritis. Giant cell arteritis can occur in the central retinal arteries as well, and that can be extremely dangerous. It can lead to losing sight because it leads to stenosis of the artery. But we'll come back to that later. Okay, so ophthalmic artery on each side enters the orbital cavity through the optic canal. The first branch it gives off is the central retinal artery that penetrates through the meningeal sheath surrounding the optic nerve and then runs in the centre of the optic nerve. The next branches that it gives off is the major branches we're doing is the lacrimal artery here, and I will just label a few of these up. So this is the lacrimal artery here in red. And then it carries on laterally, so I'll get the thicker red pen back again, and I need to be very careful here because I don't want to destroy my picture of the nerves by doing this, so I'm going to put it in this position. This isn't quite the position that ideally I'd have it in, but it's the position I'm going to put it in regardless because I don't want to obscure all of this good anatomy that we've got of the nerves here. So here it continues on, and it's going to give off the supraorbital artery, so I'll put this over here, which is going to go with the supraorbital nerve here and through the supraorbital foramen, and it will come out on the surface of the forehead and it will supply the forehead with blood. And then the rest of it continues on, and now the bit that we are very, very interested in is it's going to give off an anterior ethmoidal artery, and I'm putting it on this really strange path because I don't want to obscure all the other nerves. So here we go. Here is our ophthalmic artery. So here are the branches that I'm going to now tell you the names of. So here it continues on after giving off the lacrimal branch here. It's given off the supraorbital artery, and I think actually I'll just label that one up. So one next to the supraorbital nerve here, that's the supraorbital artery which supplies the forehead. It's not, however, the only one that supplies the forehead. We're also going to have a supratrochlear artery that goes with the supratrochlear nerve and supplies the forehead more medially, and that's what the ophthalmic artery becomes eventually. That's one of the terminal branches of it, along with this anterior ethmoidal artery, which is the one that we really wanted to discuss, so I'll come to that last. So this is the supratrochlear artery. Again, that goes with the supratrochlear nerve and will supply blood to the forehead. So you have a supraorbital artery and a supratrochlear artery, as well as a supraorbital nerve and a supratrochlear nerve. And here's the thing that we're interested in here. One of the terminal branches here of the ophthalmic artery is the anterior ethmoidal artery, and it's right next to the anterior ethmoidal nerve from the nasociliary nerve there. So this is the anterior ethmoidal artery, and it's going to follow the anterior ethmoidal nerve perfectly. So all of the anatomy that we previously discussed we can now use here. So it goes up through the anterior ethmoidal foramen. Where does it come out? Test yourself. It comes out in the lateral portion of the olfactory groove here on the right-hand side, because we're discussing the right-hand side, but it's exactly symmetrical on the left-hand side. We're then going to have this anterior ethmoidal artery, which I won't attempt to draw on here, going forward and through the nasal slit, and then it supplies the nasal mucosa with blood. However, before it goes through the nasal slit, just like the anterior ethmoidal nerve gave off a branch that was going to innervate the meninges, the anterior meningeal branch of the anterior ethmoidal nerve, the anterior ethmoidal artery is going to give off an arterial branch, and that branch is called the anterior ethmoidal artery, and it's in pretty much these same positions as the anterior meningeal branches of the anterior ethmoidal nerves, and again they're going to run in the outer layers of the meninges. They're going to run in the periosteal dura mater and the meningeal dura mater and the arachnoid mater, and they're not going to ever penetrate through into the subarachnoid space. Okay, so we have therefore just discussed the anterior meningeal arteries, which are branches of the anterior ethmoidal arteries on both sides. You have two anterior meningeal arteries, a left anterior meningeal artery and a right anterior meningeal artery. So although we spent so much time discussing the anatomy of that one, it's only a very small little artery. It's nowhere near as important as the middle meningeal artery, but it does supply blood to the frontal and the orbitofrontal meninges over there. So it is nevertheless important. So the last one then, the two posterior meningeal arteries, where are these going to come off? They're going to come off a branch of the external carotid artery that I haven't previously told you about. And this branch is called the ascending pharyngeal artery. So it's a minor little branch. And I'll choose another colour rather than doing it in green again. What colour should we go for? Aquamarine shows up quite well. So we'll go for aquamarine. So back to this picture. So here's our external carotid artery giving off the facial artery here. Now before it gives off the facial artery, one of the branches that it gives off is the ascending pharyngeal artery. So I'll put this in this position here in turquoise here. So this artery, and it will be external of the internal carotid artery. At least I think it's external of the internal carotid artery. I don't actually know which one is more external, the ascending pharyngeal artery or the internal carotid artery, but it's in this sort of position here. So in blue here, this is the ascending pharyngeal artery, and of course we're seeing the left-hand side here, so this is the left ascending pharyngeal artery. So, one of the very early branches of the external carotid artery is the ascending pharyngeal artery, and these are going to go backwards from the external carotid arteries. Now, one of the branches of the ascending pharyngeal artery is then the posterior meningeal arteries. So let me put this on here. So in blue here, this can represent the posterior meningeal artery as a branch of the ascending pharyngeal artery. So this bit here, that's representing, and I really do need some more space, come down here. So this is representing the posterior meningeal arteries, or it's representing the left posterior meningeal artery, but you'll have a right one as well. Okay, so how does this then get into the posterior cranial fossa, where presumably it is going to go? Well, it goes through the jugular foramina. So we haven't got them on this picture, but I'll put them in. So we've seen the jugular foramens or jugular foramina before. They are the places where the internal carotid not the internal carotid arteries, the internal jugular veins are formed. So the sigmoid sinus, the sigmoid dural venous sinus empties into the jugular foramen, and then catching all the blood is the internal jugular vein on the other side. However, not just does the internal jugular vein emerge from the jugular foramina on both sides, but also this posterior meningeal artery is going to go up through the jugular foramen. So let me put them in here. So here is the left jugular foramen, and here is the right jugular foramen. So our ascending pharyngeal artery will come up through here, and then of course again, what will it be met with? It will be met with the two outer meningeal layers, the periosteal dura mater and the meningeal dura mater, and again it's not going to penetrate through them, it's just going to run in them. It's not going to try and get into the subarachnoid space, it's just going to run in them, and it will supply the posterior cranial fossa. So, again, this was a nice easy one rather than the anterior meningeal arteries, but again, this is quite a small little artery compared to the middle meningeal artery, but it is nevertheless important to know about. But overall, if you're just going to learn one of them, learn the middle meningeal artery, but learning all three of them justifies why the middle meningeal artery is actually called the middle meningeal artery, because there is also an anterior and a posterior meningeal artery. Okay, so that completes our discussion of the meningeal arteries. These are the arteries, remember, that supply the actual outer layers of the meninges, the dura mater and the arachnoid mater. And most of the territory of the outer meninges is supplied by the middle meningeal artery. All of this lateral sort of region, this is all done, it's all dealt with, it's all supplied by the branches of the middle meningeal artery. It's only right at the front that we need the anterior meningeal arteries, and right in the inferior back, the inferior portion of the posterior cranial fossa, where we need the posterior meningeal arteries to supply blood to the outer layers of the meninges. So we'll have a break here. In the next video we'll move on to the extraaxial cerebral arteries. We'll have a look at the anatomy of some of the major extraaxial cerebral arteries, including the anterior cerebral arteries, the middle cerebral arteries, and the posterior cerebral arteries.